Hello, we got a denture today, an immediate denture. So you can see the preoperative image of our patient. We've got lots of non-restorable teeth. He has made the decision, instead of investing in restorations or fixing the teeth, he is going to be done with them and take them out. So it is our job to make him a denture. We will do that. Again, I've already designated the administration phase. Now I'm going through and trimming my model. Later, we will, or here in a moment, we will remove the teeth from the cast. So, I'll do that here in just a second. So, sorry, I was texting another dentist. All right, we've trimmed our model. Looks good. Now we're going to use this replace tool, and we are going to guess at what he's going to look like after surgery. So the reason I say guess is because we don't know how he's going to heal. You take teeth out, and sometimes you've got to cut bone away, and you're sectioning roots, and you're doing different things to keep the patient comfortable and get the tooth out as atraumatically as possible or without trauma. And so we don't know exactly what his arch is going to look like when he heals. But what we do know is that he's going to look different. Like a month, 2 months, 3 months after he gets his teeth removed, all of his gum tissue is going to heal. So we're going to guess at what he's going to look like while he's got teeth, or we're going to guess what he's going to look like after surgery. And then we'll make him a trial denture. So that's what this rendition is going to be. It's just a trial. And then when we go to final, we'll take a wash impression, we'll redesign, and we'll make him his final. So we're just drawing margins here, getting ready to use our replace tool. It's kind of scalloping around these teeth. It doesn't have to be this precise. All right. We're going to click apply. See if that calculates. Should take all those teeth off of the model. There they go. We're going to finish with this one. Didn't quite get to. Cool. Okay, so that's what he looks like without teeth. Now, our next job, I'm just going to flatten this. Our next job is to create some ovate conic spaces. So we're going to use this form tool. We're going to come in with this removal. We're going to simulate some extraction sockets, and it doesn't have to be super fancy, but we know that when the teeth come out, he's going to have holes there. So I'm going to kind of simulate some of that. This form remove. So I'm just going through, creating those ovate conic spaces. Do some back here. I could do more, but let's remember this is a trial denture. So I think that will work for our purposes. right, we're gonna have to open his bite some. So we'll do that here in just a minute, but he's not gonna have enough room for those teeth. Let's work on our denture baseline. So we're just drawing it in the depth of the vestibule. This is going to be the border of our denture. We're going to come around that frenum there, back up to his vestibule, and boom. Okay. So let's change a couple things. I think that looks pretty good. All right. We're going to jump straight into model analysis. We're not even going to move these dots. I don't care about those dots. It's not important to me. We're going to be doing a tooth setup here in a minute. So let's get into positioning. We're going to get a rough idea of where these teeth need to be. So first thing we're going to do is click that harmonic setting. We're going to select all of these teeth together, move them in a linear fashion. And we're going to start playing around with some things. Okay. Now, like I said, we're probably going to have to open his vertical some. I'm going to turn off the screen here for a moment and check something. I don't want to give away any PHI, so I'll turn it back on in a moment. Actually, this should be okay. All right, back to inline. He's got pretty short teeth. Check his patient photo. 1 moment. So his incisal edge position is actually pretty good. That's okay. I'm going to calculate the base plate just to see if it will even calculate. Looks like we're going to need to open him. So if I already know that, we'll do that before we go through the trouble of a big design. So let's edit our denture base plate. Computation failed. Let's see why. May have to bring his model into Mesh Mixer. Mesh Mixer looks for areas that need to be repaired. So this might be a tomorrow angle, team. But you saw some of the workflow. So still learning these dentures, getting better every day. You've seen some of that design and more to come. So thanks for watching. Have a good day. Finish this later.